that we need to process right now, from concerns about getting sick to financial worries to disappointment over the way our life is being disrupted. The crisis has been taking a toll on our mental health. So we're bringing in Paula Tutman. She has been talking to an expert today about how to properly deal with all of these effects. And there's a lot to deal with, Paula.
Well, and these concerns are real, so we don't want to minimize that at all. But there are some concerns that might be perceived. You don't have to go far to find really, really jittery nerves. And the question is, what are the conversations we need to have with ourselves so that we don't create panic within ourselves, so that we can at least work our way through our fears? You need only look around the parking lot of any grocery store and see that it is packed in the middle of the day on a weekday, and know that people are anxious and worried.
Everybody kind of looks at each other differently and, that kind of thing. But they're all, hurrying, and some people are more considerate and other people don't make eye contact.
There are serious things to be concerned about, and everyone's shopping list of anxieties are different. Kids are out of school, childcare, safe travel, who's standing next to you, a whirling cocktail of what ifs and no real answers or clear guidance from many of the people who we generally count on for real answers and clear guidance.
They're not getting the right information, and they're going along with their own thoughts.
Troy psychologist Dr. Franklin Sollers, clinical director of Sollers and Associates and Psychological Services, says the big picture is terrifying. And so to manage anxiety, perhaps you can start focusing on the small picture.
Look at the good things that you can do, things you can control, and the losses, don't exaggerate them and focus on the fact that you'll get through them.
He says triage your disappointments and the changing world around you by putting things in perspective.
If you lose a basketball game, it's not so bad, really, in the end. If you have to stay home from work and work remotely, that's not a great loss.
For children, he says, talk to them in reassuring language. Even if you're not sure, make sure they are sure. Everything will be okay, and together you'll manage.
So reassure them that they will be okay, and they will. I think that's honest.
And mostly fight the impulses of gravity. Of course, we are all creatures of gravity, but that pulls us down and makes negativity easier. By embracing positivity and choosing positive self-speak over the easy route of panic, you can help manage your own nervousness and anxiety.
Reassure yourself this will pass. It's being, the viruses are getting smaller in China. This will pass, and if I take care of myself well, I'll be okay.
Okay, listen, and we know that if you've got a kid studying abroad, you've got to get them home safely and then figure out quarantine. Or if you just lost 20% in your 401k, it's not that easy to just breathe. But if you're able to manage your fears instead of panicking, then you can start thinking of smaller ways to start figuring your way out of some of these things, or at least keeping yourself from panicking. Karen?
All right, some very good coping advice. We appreciate it, Paula. Also, first at 4, coming up new at 5, as school districts consider moving to online lessons, we take a look at concerns about a digital divide and the impact on families. Also new at 5, how first responders are changing their procedures because of coronavirus. And Dr. McGeorge has posted answers to frequently asked questions on our health page on clickondetroit.com.